With me now from Naperville, Illinois, is Dr. Raj Kalsi, is a board-certified emergency medicine physician. It's good to see you again. Thanks for being with us.
Thank you, John.
Okay, we'll start with the US president, who had some criticism of his Democratic rival Joe Biden for wearing a face mask on Monday at a Memorial Day service. Here he is.
He was standing outside with his wife, perfect conditions, perfect weather. They're inside, they don't wear masks, and so I thought it was very unusual that he had one on.
The president was sort of implying Biden wasn't really at a risk while outside, but this is the advice which we've constantly heard from senior government health officials. Again, listen to this.
As the country begins to reopen, don't forget to wear a cloth face covering when in public.
We have the scientific evidence of how important mask wearing is.
Go out, wear a mask, stay 6 feet away from anyone.
A mask does prevent droplets from reaching others.
As long as you're not in a crowd and you're not in a situation where you can physically transmit the virus. And that's what a mask is for.
Remember, I wear my face covering to protect you, and you wear yours to protect me.
So the bottom line here is that there is a risk, but it's a gradient of risk. Outside may be lower, but there's still a risk. And also, add to this, we still don't really know a lot about how transmission occurs. So I guess, without getting into the politics of it all, is someone right to be wearing a mask outside even on a nice day?
Absolutely. And I think individuals will mitigate their risk individually. And it's hard to say what to interpret with President Trump's remarks about Biden's use of the mask. I think leadership comes with a great gravity in terms of you lead with example. And we know what science and scientists have told us about COVID. And the best of science tells us that wearing a mask in close proximity to others, certainly within 6 to 10 feet, is important. So to see someone like Biden wearing a mask is representative. It's leadership. To make comments anything less than complimentary of that leadership is derogatory, in my opinion. When people go out and they choose not to wear a mask, two things happen. One, they do confer some risk to themselves as well as to others, but they also suggest and they confer some uncomfort to other people watching them, because some people are invested in wearing masks and believe in science, and that's not fair to others.
It's funny you should mention that, but this whole, leadership by example, what the president does, or does not do, carries a lot of influence. I want you to listen to one man who was not wearing a mask, and this is his reason why. Here he is.
I mean, if he's not wearing a mask, I'm not going to wear a mask. If he's not worried, I'm not worried.
And the he was referring to there was the president. So if someone's not inclined to wear a mask, or they see a leader not wearing one, that seems like tacit approval not to do so, even though the overall benefits in slowing the spread of the virus are well known.
Absolutely. We have to start from the top down. And I think with all due respect to the executive branch, we need to just give up our personal grievances towards the left and the right and whatever we don't believe in, and focus on the people that we govern. Again, as I've come on here many times and said, I'm not a politician, but I believe in science. And science tells us something very simple: wear a mask. And if leadership is not doing that, there is a strong percentage of people out there in America that are counting on leadership to guide them, whether it's visually or verbally, and they're going to listen to them. So if they see President Trump now wearing a mask, they're going to do the same, as you just heard there.
Yeah, and you're adding to this pile of what is and is not known. We now have this new information about testing, and in particular, antibody tests used to determine if people have been infected in the past with COVID-19 might be wrong up to half the time, the U.S. Centers for Disease and Control and Prevention has said. Now, on the upside, it means they're right at least half the time. But why have there been so many problems here with testing? And if the tests are not reliable and there's no vaccine, what does that mean for efforts to try and control not just a second wave, but maybe a second peak?
Great question. We are pushing the envelope because this is pandemic. This is unprecedented times, John, and we are pushing science to speeds they're not used to and not meant for. So these tests are being pushed beyond what we're notably and reliably able to allow them to be pushed to, and we're getting false negatives. False negatives mean somebody is positive for antibodies, but the test says negative. And that's frustrating for sure, but it's something we're being asked to do as scientists and doctors, is get the people the tests that they want, because we're afraid, and fear is driving a lot of this. Fear. If it wasn't for the fear, we'd be taking our time, sitting back, and only vetting the tests that were appropriate and valid. What does it say about moving forward into safety for America? That we cannot rely on these tests, absolutely. And we don't know how to really interpret a 50% sensitivity test for moving forward and determining who's safe and who's not.
Very quickly, we're almost out of time here, but we're looking at maybe the second peak in 4 to 5 months to coincide with the flu season, the seasonal flu season. Overall, is that enough time for this health system to recover after it's already been through so much stress and strain at the beginning part of the year? Is it time to restock, to rebuild, for everyone to get back up to speed, for healthcare workers to go back out on the front lines and be up to, full speed, if you like, in that short period of time?
Not at all. Not at all. We still, John, don't have the appropriate PPE for COVID right now. We are months away from a flu season. What on earth are we going to do when we have people with influenza who have the exact symptoms of COVID? What are we going to do? We will not have the supplies. We will not have the robust safety measures in place, because right now, as evidenced by all of healthcare, we just don't have it now. So I have yet to see the evidence that we'll be prepared for the next few months for the flu, in addition to a possible Fauci predicted second wave of COVID.
Yeah. Dr. Raj Kalsi, thank you so much. We appreciate your insights and best of luck.
Thanks,
thank you, sir. Take care.
Thank you.